it's a health problem that happens to 1 out of every 100 couples who find out they're expecting a baby.
Yeah, a local hospital is standing out nationally when it comes to helping these couples. And Meg Ferris is joining us now in the studio to find out why.
And I appreciate this family sharing their story. Last year on St. Patrick's Day, a Metairie family got some difficult health news, but with the experience of a specialty surgical team, as you will see, this St. Patrick's Day, they have a lot to be thankful for. The Reller family had done it before, 3 times before, in fact, gone in for a routine anatomy scan of their baby who was on the way. But something was different this time with baby number 4.
We're so down to earth and calm and relaxed, we're not going to find out what we're having. But then, you know, they were kind of taking a little while, looking at the heart, and I was like, something's not right.
It was almost like the silence or the pause was telling us more about the situation than really any words from anybody. We knew there was something going on.
Abigail and Aaron will never forget. It was St. Patrick's Day last year when they learned their baby boy would come into the world with 3 heart defects. Among them, a big hole in his heart, and the 2 main arteries were backwards. When baby Thomas was born on July 21st, he went straight into the Ochsner Cardiac ICU to await surgery. 3 weeks later, a complex 6-hour surgery. Baby Thomas's heart is stopped while the heart-lung machine takes over. Surgery's more risky on infants in the first month of life.
If the operation goes well, you can really render Thomas a normal heart.
Dr. Benjamin Peeler is chief of pediatric and adult congenital heart surgery at Ochsner. He says heart defects happen in 1 of every 100 babies born in the U.S. Some are genetic, but most are for an unknown reason.
It's an incredibly complex 3-dimensional structure, and so the fact that it ever forms normally is a miracle.
You're just waiting, and you're trusting, and these doctors are amazing, and this is what they do.
Thomas's surgery was a success. One parent had to be with him at every moment once he went to the hospital floor. After a total of 40 days in the hospital, he finally gets to go home and meet his big sister and 2 big brothers.
When you get to hand back a baby who was born with this tremendous defect to parents and say, your baby boy is fine, his heart is normal, how does that make you feel?
Yeah, how awesome is that, right? I mean, I get to do that just about every day, which is really, it's awesome. I mean, I've been doing it for 20 years, and that part of it never gets old.
The Rellers say what helped them through was the support and information they got from other parents going through the same thing, and the NOLA HOTS podcast and the Henry Aucoin Foundation. It was also that they were in good hands. The latest 5 years of data from the National Society of Thoracic Surgeons show that babies who have cardiac surgery at Ochsner, even the most complicated cases, are far more likely to survive. Still, nearly a year after that scan, Dad gets choked up as he reads a note he wrote to his son back then.
She calmly introduced herself to us while we were slowly internalizing the fact that our lives were soon going to change. She looked at the ultrasound and quietly tapped on the keyboard.
And who knows, maybe Dad will read this as his toast at Thomas's rehearsal dinner one day. But for now, there are a lot of little boy things he gets to do first.
Thomas has got a normal heart, and he's got a great chance to just be a normal dig for the rest of his life.
Will he be able to do all the things that, a young boy's going to want to do, play all sorts of sport?
He better go do all those things.
Now, you heard Abigail mention, the mom, that other parents going through the same situation helped them get through. We have a link on our website to those podcasts by 2 Heart Moms and the Henry Aucoin Foundation that helps with finding children who need heart procedures, help with funding rather for children who need heart procedures and medications.